Hello friends, today we're going to discuss about how to approach final exams. I'm Dr. Suresh Badadmat, Professor of Psychiatry working at NIMANS, Bangalore. In this video, I'm going to discuss about how to approach final exams, especially in professional courses such as doctors, engineers, lawyers, chartered accountants, and other professional exams. In this, I'll be dividing the whole video into three parts. In the first, I'll be discussing about how to approach theory exams. In the second part, I'll be discussing about how to approach practical exams. And finally, the viva voce. So let's discuss about theory exams. So before you start reading about the final theory exams, you need to understand and learn and inculcate certain practical tips. Practical tips number one. Most of our professional students who are preparing for the final exams, especially theory, they often complain they forget very fast. Whenever a student learns something and within 1 hour, he will be able to retain only 44%. By the end of first day, it is 33%. And by the end of 1 week, it will be 25%. And by the end of 1 month, hardly 20%. That means whatever he has learned within 1 month, he will be forgetting. Hence, you need to know when to do revision so that it gets into long-term memory. Hence, the scientist clearly has said that Ebbinghaus, who is a psychologist, who clearly said this forgetting curve can be hacked by doing revisions. Any person who does reading need to do revision within 1 hour. If he does revision in the first 1 hour, his retention capacity increases slightly up to 45 to 50%. In the second revision, which he is doing within 24 hours, then again it improves up to 50 to 60%. The third revision, his memory increases up to 80%. By the end of 1 month, if he does the revision fourth, that means he'll be able to remember for longer duration. So this is called as Ebbinghaus forgetting curve, and you need to learn how to hack this. The hacking is done by revision. Revision immediately after studying first, within 24 hours second time, first week third time, the end of 1 month fourth. But one need to understand, revision does not mean the same amount of time required for the first learning. Here, you need to understand when the first revision occurs, he requires hardly 50% of the time what he had spent in learning first time. That means if he had took 1 hour to study a subject, in first revision, he will hardly take 30 minutes. In the second revision, it will be hardly 15 minutes. And further, it will be 10 minutes. And then after the fourth revision, it may be 5 to 10 minutes. So subsequent revision will be hardly 2 to 3 minutes. As soon as he sees the content, he will be able to remember all those things. So reduced time for revision occurs in the subsequent revision. And during exams, if you are able to make notes, and if you look at this revision timing, that means you'll be able to do the revision of the whole subject within a matter of 1 to 2 hours. And you'll be able to remember everything. So that is what is Ebbinghaus curve, and how to hack this Ebbinghaus curve, you need to understand that. So you need to study smart, not hard. If you study hard, but you are not smart of understanding the science behind forgetting, you will be forgetting what you have learned. So what is the important point you need to understand is make notes from the day one. Start revising as and when required. And best is immediately after learning, further within 24 hours, first week and first month. So the key to success is revise, revise and revise. And please do remember, do not read from others' notes because you have not learned by yourself. Somebody had made notes and you are trying to take whatever they have understood and you will not be able to comprehend the notes. That means you will be able to understand to some extent, but you will not be completely understand the concept of the notes. Practical tips number 2 for theory exams. Here, you need to employ something called as Feynman method, given by Richard P. Feynman. According to Feynman, he clearly said that whatever you have understood, learned, you need to explain in simple word to yourself or to the friends or family members or any other imaginative people, you'll explain them and teach them. So, this Feynman method clearly says that by reading, you'll be able to retain only maybe 25%. By writing 50%, by teaching others, you may be able to retain up to 80%. That means you need to do group study. You need to teach others. And when you teach others, understand the concept, reduce the concept into simple words so that you learn associative learning. By this method, this goes into long term memory, and you'll be able to answer any final exams by doing this method. So, please do group study and employ Feynman method. Practical tips number 3 for theory exams: solve question papers. Try to collect question papers at least for 10 years. Solve those question papers. And when you take this 10 years question paper, start chunking these questions into based upon the chapters, based on the subject, and get oriented. What are the questions? What type of questions are asked? Whether it is a long questions or short questions. So you need to understand the examiner's mindset and how the questions are framed. By this, you'll be able to prepare for your exam. Not only that, practice question papers. Take around 3 years back one question paper, try to do mock exam, try to write the exam within the stipulated time. And each time you need to balance between how much time you will devote for each questions. Speed and handwriting should be balanced. If you increase your speed, your handwriting may be very, very distorted. That means you may lose marks. Hence, the speed and the handwriting should be balanced. So that can be done only by practice. That means revise and practice are the two important key for success in theory exams. Practical tip number 4: start early. That means you need to start make notes from the day one. And when you make notes, take from the main textbook which has been advocated by many of your teacher. And if possible, try to make notes even from Indian author books, because Indian authors usually understand the concept and they make it very simpler. By understanding simpler and you're able to communicate in a simple words, that means you'll be able to retain for longer duration. And at the same time, do research. Do research and find a good review article about the subject and make notes from them also. These are very essential tips to get the topmost marks. Please understand, the intelligent student are those students who make notes, and those notes will be pasted in the doors, maybe where the person sleeps or wherever he watches television, so that whenever he is watching television during advertisement, you'll be able to go through these notes. Or I've seen many of these students, sometimes they even stick these notes in bathroom, in toilet doors, so that when they are going to the bathroom and in that free time, they'll be able to do the revision. And please remember, last minute preparation, if you do, that is a recipe for disaster. That means you need to start early. Practical tip number 5 for theory exams: before you start learning, you need to understand the concept, comprehend the concept, what the author is trying to convey, and also ask questions to understand. If you are unable to understand, seek help from your teachers, maybe your seniors. Sometimes you may not be able to access teachers. Please try to browse YouTube videos and try to understand the concept from there. Once you are able to understand the concept, you'll be able to communicate. But again, when you communicate, please do use technical terms, especially when you are giving professional exams. Practical tips number 6. Before the exam, that is 1 or 2 days prior the exam, sleep well. Your brain requires rest. If you are able to take rest and your brain is calm, you'll be able to recall many of the things what you have read. And hence, giving rest to the brain means your brain will be able to perform very well at the time of the exam. But also, do not avoid or abstain from taking the exam. Don't be absent just because of fear of failing the exam. Failing the exam does not mean that you are the failure in life. If you quit the exam, yes, of course, you have quit the exam. That means it will be considered as a failure. Instead of that, face the exam boldly. Even if you fail, that is an experience for the next exam. Please don't run away from the exam. The more you run away from the problem, you need to come long distance again to face the solution. That means please face the problems at the earliest. You may require anxiety reducing techniques, sometimes yoga, sometimes meditation, maybe spirituality. And if you don't believe in all these things, please take professional help, and medicines may be required to reduce your anxiety. Moving to practical tips number 7. On the day of exam, go to the exam hall early so that you know where is the exam hall, where is your seat, where is the toilet, and where to keep your bags. You are able to understand. Avoid reading outside the hall. That means if you're reading outside the hall, you have to carry the books. If you carry the books, you are worried where you have to keep the books, where you keep the bag. So avoid reading outside the examination hall. Keep your mind calm. Do not carry your mobile phone, because if you carry mobile phone, it will add to your stress. Hence, go without mobile phone. Don't carry any books. Keep your mind calm. Practical tips number 8. Answering the questions. When you get the question paper, look at the question paper. See whether any paper is missing, whether any part of the question paper is not printed. Many a time I have found many of the students would have not got the complete printed examination paper, or else one side of the question paper is missing. So look at that and see whether it is completely for 100 marks or whatever the marks it is depicted. First, read the questions as a novel reading to know what are the questions have been asked. The first reading has to be done in a simple way. In the second reading, try to mark the questions which you know the answer and start visualizing the answer. What will you write? What will be my subheadings? How much time I will spend in this question? How to leave space and how to make important points for the exam questions so that you are able to clearly communicate the examiner that you know the subject, and you try the questions which you know the answer very well and try to answer those questions which are difficult in the end. Practical tips number 9. Answering the questions. When you answer the questions, very important is how well is your handwriting, how well you are presenting your answers, and you need to use pen which enhances your writing skill. And if you're using ball pen, please take the ball pen to your examination hall. Use those ball pens or the pens which you are using daily. Don't take a new pen to the examination hall. That means you are not used, or your brain is not used to use those ball pens or the pens which you are not used regularly. And try to underline the keywords and also use appropriate space between two questions or two answers. Draw a line between two answers so that you are demarcated well. Practical tips number 10. Answer the questions by using flowcharts, diagrams, pictures, and tables so that you decrease your writing. By indicating or by showing the diagram or pictures or flowchart, you are communicating the examiner that you know the concept and you have understood the concept very well. Here, these kinds of depiction will tell the examiner that you are very well organized. You need to communicate the examiner that you know very well and you understood the concept. Practical tips number 11. Check your question paper and answer sheet before you submit. Check your roll number and name. Check the numbers of questions you have answered, how many you have written well. And if you have left something, please add that. And sometimes you need to highlight important points and concept so that the examiner do not miss when he is giving or awarding the marks to you. Practical tips number 12. Preparing for the next paper. Immediately after you have finished your paper 1 exam, don't do post-mortem immediately. Avoid discussion about the today's question paper. Focus on the next paper. Your today's performance on that first paper should not dictate tomorrow's paper. Many a time I have found students will be worried about how much I will score in the today's paper, and they find that you have missed out 2 important questions or you have written wrong. That will have impact on the next paper, that is which is tomorrow. Hence, Avoid doing post-mortem of the paper immediately. Immediately start focusing on the next paper. Once you have finished the exam, you can do the post-mortem later, but not immediately in between the exam. Practical exams. Let's discuss about what are the tips you should know about the practical exams. In the final practical exams, when you go there, you need to face the examiner. Anxiety may pick up, and the questions can be different for the different students. So, whenever you do practicals, have a template in your mind. What are the questions will be asked? And you keep a normal template in your mind. What are the different types of lab questions will be there? What different types of cases will be provided? What are the different types of case vignettes will be given to you? How to manage them? And also do video recording of your answering and see how you are presenting it well in front of the examiner. So you need to present cases, practical cases to your seniors, senior residents, teachers, and tutors so that you get well versed in practical exams. Hence, you need to have a template in your mind. Suppose if you are presenting a case in a doctor's exam or in MBBS exam, you need to have this demographic detail template clearly, chief complaints, history of presenting illness, past history, family history, personal history, premorbid history, and general physical examination, mental status examination, and cognitive function. And if you are able to know this template and you know the answers in a normal function, how to present it, that means your work becomes easy. Very important thing is you need to know how to organize your information, how to organize history, how to edit your history, and how to present properly to the examiner. Remember, examiner is also a human being. Don't make their life tough. If you make their life tough by providing unnecessary information and jumbling up the information, not organizing your information, that means examiner will be irritated. That irritation will be shown when he is giving marks to you. Hence, learn to manage your time, learn to organize the information and present it to the examiners. Practical number 2. Associated learning. Associated learning is the best. Whenever you see a particular case or particular lab work, go back, read the theory. That means whatever you have learned practically should be paired with theoretical examination. When you are learning for theory, make notes. That means practical experience or theoretical knowledge association, your memory becomes solidified. That means you'll be able to remember this for longer duration. By doing revision at the end of 1 hour, 1 day, first week, and first month, that means you are putting this in the long-term memory by this association learning. Hence, to further solidifying your memory, you need to teach other people or other students or your colleagues what you have understood and how to do the practical examination. Do discussion with your teachers, tutors. If possible, do mock presentation about how in exams this will be conducted. By doing mock presentation, you'll be able to be prepared, how to answer in the exam, and how to anticipate questions in the exam. Practical tips number 3. You need to understand the difference between summarization and formulation. Summarization is summarizing the whole case. Here, as in the template, demographic details, chief complaints, history of presenting illness, family history, personal history, you will summarize everything and you will be summarizing the positive findings as well as negative findings. Summary means discharge summary the way it is given in the hospital. And in summary, it is the reinstatement of the facts and it is written in a layman language and also in technical term. Whereas formulation is different. Formulation is the positive finding only documented using technical term in a medical language and it is communicated to the another professional to how you have thought about the diagnosis, what made you to think for that diagnosis, what are the management plan, what is the prognosis and final diagnosis. Formulation has a lot of analytical in nature. Plan of management will be clearly written and also it will be given when you are referring to other people. Hence, formulation is useful for communicating the diagnosis and management plan to other professionals. Whereas summary is a summary of case which is given to the patient and the other parties or maybe even to the insurance company and it will have less of technical terms. To summarize, formulation means using technical terms, brief demographic detail. You are providing only the positive points. We'll be discussing about onset, duration, precipitating course, and past treatment, family and personal history in brief, remorbid personality, general physical examination, and differential diagnosis and management plan. Here, you'll be discussing using technical terms. That is very essential. And this formulation will be used to communicate the diagnosis with other professionals. Practical tips number 4 in practical exams. Lead the examiner. That means in a vast professional subject, an intelligent student will lead the examiner in the area where the student is very strong. Imagine if you have learned about tuberculosis and the patient has fever and mild cough. Here, the intelligent student will lead the examiner towards the cough and also maybe tuberculosis where the student has done thesis. In that strong area, he will be able to discuss well with the examiner and he will be able to show his capability, his acumen, and also his aptitude and also altitude of knowledge in that area. Of course, the examiner will be impressed by the depth of his knowledge. So, here you need to learn how to lead the examiner in the area where you are strong. For example, if in a medical MD exam, you know these are the information you have to collect when you are taking the long case. Now you need to understand, lead the examiner. Suppose if there is a past history of poor compliance is there, that means if the patient does not take medication. In such a scenario, you will be discussing about adherence, compliance, but you should know that area very well. Suppose there is a family history of marital discord or family discord. We'll be discussing about expressed emotion. If you are read well with expressed emotion, lead the examiner in that area. Suppose in personal history, if there is unemployment or else the patient is going to get married, these will play an important role in your management. And if he is unemployed, you'll be sending them for occasional rehabilitation. The person is going to marry, you'll be discussing about the legal implication of disclosure and non-disclosure with regard to marriage. If the person has impulsivity, here you'll be discussing about the psychotherapy. That means it has an implication in practicality. In general physical examination, if body mass index is very high, you need to discuss about obesity, how to manage obesity, how to do cognitive behavioral therapy, how to refer them to nutritionals so that you will be able to see how dietitian can play a role in decreasing the weight. If the person has abnormal movements and negative symptoms, you need to give appropriate referral and discuss those. Cognitive deficits are there, how to do cognitive retraining. Suppose if the patient is from a low socioeconomic status, that means you have to think twice before prescribing a medication which has may be beneficial, but the patient is unable to afford those medicines. In such a scenario, this low socioeconomic status may force you to write the medications which are available free of cost in government hospitals. So all these things you need to know and you need to lead the examiner in that area where your capability is very good. So if the patient has nicotine abuse and you have read very well about how to manage nicotine dependence, lead the examiner and spend time in discussion here. Practical tips number 5. Management plan starts from the demographic details. That means as soon as the patient talks about his chief complaints, about his socioeconomic status, about his past history, about his past medical history, personal history, that means that silent futures will dictate your management plan. Based upon your formulation, you need to have a treatment strategy. At the same time, your management plan should be for the first differential diagnosis. Suppose if you have 3 differential diagnoses. First one is schizophrenia, second one is schizoaffective disorder, third one is bipolar affective disorder with poor insight. In such a scenario, your management plan will be for the first diagnosis, that is for schizophrenia, and avoid making hypothetical management. For example, if the patient has schizophrenia and you will say, I would like to start Risperidone 2 mg, and the examiner will ask, next, what will you do? Don't say, if the patient does not respond to Risperidone, I will try olanzapine. The examiner never asks that. He's asking, after Risperidone, what other management you are going to do. It may be psychosocial management, it may be psychoeducation, it may be referring to social therapy, various other therapies. But don't make hypotheses telling that if this medicine doesn't work, if he doesn't do therapy, those hypotheses you don't do. The hypothetical questions will be put forward by the examiner. Don't do examiner's job. Moving to practical tips number 6. Understand the management plan in the form of locus, focus, and modus. Locus means where you are going to treat the patient, whether in inpatient, outpatient, or in rehabilitation center. What is your focus? Which symptom is your focus? Which behavior is your focus? Whether it is emotions or thoughts, that means focus of treatment. Acute treatment, what you are going to focus, that is very essential. Modus, whether you are using medication, electroconvulsive therapy, psychosocial management, what will be your acute management, or else maintenance management and follow-up management. So, focus, locus, modus, you should understand that and keep this in mind when you give the management plan. And again, in the locus, where you will admit him, IP or OP, please discuss about capacity assessment. Be ready to explain and also answer with regard to capacity. Discuss about voluntary admission under Mental Health Care Act, or else involuntary admission under 89, or else emergency treatment. If the patient has suicidal ideas, you need to think about admitting in ICU or ICU management to be planned. Focus. In acute care, what is your focus? Whether it is life-threatening symptoms or if the patient is unable to care or food refusal, what you are going to focus first. Second one is once you are done the acute management, what will you do in the stabilization phase, or that means the same medication or will you add any other medication in the stabilization phase need to be discussed. In the maintenance phase, are you discussing about rehabilitation, marriage, pregnancy, aftercare? Those need to be brought in every psychiatric cases. Modus. What is the mode of management? Is it whether you further clarify the history, treatment history, what are the investigation you are going to do, what are the baseline investigation, what medication, before starting the medication, what investigation you will do, psychosocial management, rehabilitation management, relapse prevention strategy, follow-up, and if there is a telemedicine or telepsychiatry follow-up option, that needs to be discussed. Moving to the practical tip number 7. Emergency care. If the patient is highly suicidal, or else he has catatonia, immediately you will do baseline assessment of suicide, treatment chart documentation, admitting the patient into ICU, taking consent for ECT, explaining the risk of suicidality, closed observation and monitoring, documentation in the treatment chart, telling the nurse to make closed observation, pre-electroconvulsive therapy investigation, cognitive assessment, what are the types of ECT is there, what are the alternative available that needs to be explained, and consent will be taken by the patient from the patient. If the patient does not have capacity, you will take from the nominated representative. If the patient needs to be started on medication, that will be started along with ECT. Whatever you do in practice, please do answer the same thing in the exam. Practical tip number 8. Medication. When you start a medication, please understand the rule of law. Start low, go slow. Suppose you are starting risperidone, you will say, I will start risperidone 2 mg, wait for 3 days. There are no side effects, I will increase it to 4 mg. Again watch for 3 days, increase it to 6 mg, watch for it. Once you reach the lowest effective dosage, you will continue for a period of 3 to 4 weeks. If the patient has improved around 50 to 60% or 70%, you will hike up the dosage. The patient has improved very good, that means you will continue the same dosage. What are the required investigation you will do? Whether that medication requires any explicit consent you will take, reach the effective dosage, always consider monotherapy, avoid anticholinergic drugs. Because if you admitted the patient, you know you have to observe for the side effect. If the patient develops side effects, then only will use side effect reducing medication. Practical tips number 9. Medication. Please understand. Prepare the list of commonly used first line of treatment. That means usually we will be starting sertraline, citalopram, fluoxetine as an SSRI. In antipsychotic, invariably you will be starting risperidone, olanzapine, aripiprazole, quetiapine are the medication. In mood stabilizer, valproate, carbamazepine and lithium. So name those medicines which you use very frequently. Please read about these medicines. thoroughly the mechanism of action, pharmacokinetics, pharmacodynamics, side effects, indication, dosage, any special investigation to be done. So please read about those things. Make notes about these drugs. Stick those papers or the notes in the places where you visit very frequently. Practical tip number 10. Other treatment modalities. Whether you would like to do transcranial direct current stimulation, transcranial magnetic stimulation, deep brain stimulation, vagus nerve stimulation, neurosurgery in OCD. These are all novel treatment. By answering these, you will be able to fetch a gold medal. Please read about this. Be ready to lead the examiner in this area and answer those things. Practical tips number 11. Psychosocial management. There should be an indication to do psychosocial management. Most of the patient require psychoeducation, activity scheduling. If the patient has family issues, you will do family therapy or else expressed emotion management. If the patient has personality issues, you will be referring them to individual therapy. If the patient is having a chronic condition, you will refer them to vocational rehabilitation. Sometimes they may require halfway home placement. There is a marriage or pregnancy, appropriate perinatal care, psychiatric referral will be done. Long-term medication and follow-up need to be planned. Further, if the patient has comorbid psychiatric condition or medical condition, that need to be addressed. Suppose the patient has substance use like alcohol or nicotine, then you will do motivation therapy. If the patient has obesity, delusions, depressions, cognitive behavioral therapy, you will be talking about. If the patient has anxiety symptoms, you will discuss about relaxation, behavioral therapy, JPMR. If the patient has blunted affect, negative affect, then you will be discussing about social skills training. If the patient has cognitive deficits, you will be discussing about cognitive retraining. Personality issues, you will do individual therapy. Family issues, as I said, family therapy, anxiety symptoms, BT and JPMR. That means you need to know the indication and you need to read all these things so that in the exam, you can lead the examiner and impress him by providing answers to these questions. Practical tips number 12. Prognosticate the case. Check whether the given case, what are the positive prognostic factor and negative prognostic factor. Write them and prognosticate the case. And you may have to give an impression, yes, the patient has good prognosis factor or else guarded prognosis factor or else very poor prognosis factor. That can be communicated. So you need to prepare before in hand when you present the case. Now, moving to the last part of my presentation. How to face the viva exams in professional exams. Practical tips number 1. Read about your thesis. I've done a thesis or a dissertation. Go through it before you go to viva, because invariably examiners will start asking about what is your thesis. Tell me about your thesis. Tell me about the statistics you employed in your thesis. What does that statistics mean? What was your results? Explain about the similar statistics which can be used here. Also read about the recent development in the area of your thesis. Know about ethical issues or else the recent development. Practical tips number 2 for viva. Read about common topics. It may be regarding Mental Health Care Act, RPWD Act in psychiatric cases. Read about community psychiatry, forensic psychiatry. Know about well-known personalities. Read about psychological tests, psychological theories. Know about the journal editors and other people, very well-known personalities. Read about national, international studies and surveys. Know about suicide-related facts and theory. Know about the magnetic resonance imaging, CT scan, EEG, ENMG. What are the common findings? What are the abnormal findings? Read about novel treatment and new medicines which have arrived to the market. Practical tips number 3. Mock viva. Ask your teachers, senior residents or seniors to do mock viva with you. Video record and see how you are well answering the questions. Do you have any stammering? Do you find difficult to answer? Whether your anxiety is picking up? Listen to the video recording and modify the way you answer the question. When you answer the question, be crisp when you answer it. Practical tips number 4. Responding difficult questions. In viva, suddenly the examiner may ask very difficult question or the question which you have not read at all. In such a scenario, immediately say, sorry sir, I have not read that. Or else, if you have read, if you're unable to recall, tell the examiner, sorry, sir, I've read it, but I'm unable to recall. So that you are telling the examiner, move on and ask the next question. By doing this, you're ensuring in the available given 10 minutes to 15 minutes viva, you are giving opportunity for the examiner to ask many questions and you'll be able to answer. Imagine if you don't say that I don't know. The examiner will be asking the same question or the questions related to the topic which you have not read. Invariably, the 10 minutes will be spent in the area which you don't know anything. That means there is high possibility you may fail the exam. Hence, say sorry, I have not read that area, or else I am unable to recall that area. Practical tip number 5. Know about psychological tests and instruments. Know about IQ test, projective test like Rorschach test, TAT, various like draw a person's test, sentence completions test. Know about neuropsych assessment, lobe function. Know about learning theory, memory, emotions, personality, long-term potentiation, and also memorization, memory, and depression. Know about various important psychotherapies and also current event in psychiatry. Practical tip number 6. Know your examiner. If you know your external examiner, what is his area of research, what he likes to read, you are able to know that you can lead the examiner in that area, discuss that, you can impress the examiner. So anticipate question from those examiners, what in which area is good and what are the areas he has prepared well, or else know what are the recent publications your examiner has done so that you can read those and without forgetting you can answer this in the viva voce. Moving to practical tip number 7. Know your examiner, as I mentioned, prepare answer to the question you did not attempt in the theory paper. For example, you have given a theory paper and you have not attempted 2 questions. In viva, definitely the examiner may ask, have you read this? You have not attempted these questions. Suppose if you have not read even during viva, that means it will depict very badly on you. If you have read that, yes, you can say that, sir, when I went back, I read those questions. That means you are a person who are making efforts to learn or making efforts to know things which you do not know. That gives a positive attitude that will have a brownie points when you take viva. Practical tips number 8. Take help from your friends. Whenever your friends go to viva first, when they come back, ask what are the different types of questions were asked, what is the current examiner's mood, what they are expecting, whether they are expecting long answers, short answers, very crisp, so that when you know what are the questions asked, that questions, if you are able to prepare or that area within another next 15 to 20 minutes, high possibility will be able to answer those questions. Practical tips number 9. Learn to deal with your anxiety. In majority of the viva voce and practical, many of the students fail because of extreme anxiety. They do not know how to deal with the anxiety. And if they do not know how to deal with the anxiety, even if they have read, they will become blank. Hence, you need to learn some anxiety reducing techniques. As I mentioned earlier, it may be yoga, it may be meditation, it may be spirituality, it may be going to the temple before the exams, or else seeking professional help, or else taking anti anxiety drugs, or maybe propranolol, or else exposing yourself to the mock viva exams. The more you yourself exposed to these mock exams, that means your anxiety starts decreasing. To conclude, my dear friends, you need to understand that whenever you learn something, understand the concept, comprehend the concept, able to give those answers in a technical terms, that is very essential. And if you are not subscribed to my channel, please subscribe to the channel Suresh Padadmat. At the same time, Basics of Psychiatry is available. Various videos I have made that will be very helpful during your exams. To conclude, exam tests your memory. Life tests your wisdom and skill. Hence, if you fail in the exam, that does not mean anything to anywhere. It is just you have failed the exam. There is a life which you have to lead the life with your knowledge, with your skill and wisdom. A good, well-read student is better than the examiner. Examiner would have not prepared very well. It is the student who have prepared well. In exam, don't show your MSc, that is your psychopathology. Display your cognitive abilities by answers. And remember, revision, preparation, practice are the key to success for any exam. Thank you very much for giving your valuable time. Stay safe.